Now, Dr. Bilski, it's been a long time since I was in high school and got into a fight. Actually, I never got into a fight, but I've seen movies.
You got picked on.
That's one way to get jaw pain, but we're here to talk about teeth. Can my jaw pain ever be caused by teeth?
You certainly can have jaw pain from your teeth. The short answer is if you clench and grind and crack your tooth and it goes into the nerve, you're going to get jaw pain because
it's an infection or something?
Not always. It's an infection. It can't just be a fracture, and then the elements, hot, cold, chewing. Yeah. It just hurts.
Yeah.
If you have an infection, you certainly have jaw pain. You can get a swelling. Then you can move on into if you have the quote TMJ syndrome, which is temporal mandibular joint disorders or dysfunction, which the teeth are pressing all the time. It can create muscle pain, but most patients will say, my jaw is killing me, or it could be muscular. So quick evaluate. It's easy to figure out real quick. A lot of ENTs see patients with muscle pain or ear pain, and they get diagnosed by the physician or ENT or in other words, hey, go see your dentist. I think you might have TMJ. And then when you come in, we need to find out if it's nerve pain, if it's muscle pain, or if it's tooth. And if it's nerve pain associated with a headache, there's physical therapy and a retainer that we'll talk to you about. And then maybe your bite is off, and then we can do adjustments, or maybe you're missing teeth. It just opens up, and we can kind of tell you relatively quickly what we think.
Well, can I ask you? I mean, you're not a doctor of medicine, so but I mean, would it ever make sense if somebody has jaw pain, just maybe go see the dentist first and go, can you take a look versus the doctor? It doesn't matter.
No, you're right. No, it could be. So here's the thing. This is what happens. Someone has a toothache, so they're getting jaw pain, but we take an x-ray, there's nothing with the tooth, but it's definitely the sinus on the upper teeth. So you can have sinus issues creating tooth pain.
Okay.
So you go see the physician, the ENT. Then, or they see you and it's not a sinus because they look in your mouth and there's a hole in your tooth. So it's hit and miss. So any ENTs that are watching this, we love you guys and gals, and the same vice versa. I hope we're just trying to work together. And then that's the funny part. Not so funny when you're in pain, but patient comes in like, it hurts like this, and we tap on the tooth and there's nothing wrong. There's not hot and cold. X-ray looks fine. But then they say, when I lay down or I bend over to tie my shoe, it hurts. Like, that's a postural change, meaning I bent over. It could be sinus. And they go in and sure enough, they have a sinus. Now in our office, we can take an x-ray that will show it's called the maxillary sinus, the upper sinus. For the lower, it's a little different. You could have ear pain radiating because of infection, putting pressure on the nerve that runs down. That's the nerve that we shoot for when you're having a filling.
Oh, that's the one, huh?
Where your tongue and your lip, and your chin is like,
that's it, huh? Yeah. That's the one.
And that's the same nerve that creates headaches. So the numbing nerves that we numb in the dental practice.
Would it numb a headache? I'm curious.
Sometimes people say when they get dental work done, their headaches go away.
Oh, no kidding. Well,
which is a diagnostic tool that we already know you have headaches because I've already identified that. So we would evaluate your bite. We have these sensors that you bite into. It tells us